Communicable Diseases Epidemiology Section Chief Tracy DeSalvo and Enteric and Waterborne Diseases Unit Supervisor Jordan Mason. Thank you both for being here. And you both have really long titles. You have a lot of letters after your names. So let's start just by giving folks an idea of your backgrounds, please. Let's start, Tracy.
Sure. So I have a master's degree in public health from the University of Wisconsin-Madison, and specifically training in epidemiology. And then I've worked at the Division of Public Health for more than 10 years as an epidemiologist and the supervisor of the Communicable Diseases Epidemiology section.
And Jordan?
So I also have a master's of public health from UW-Madison, and I also have a doctor of veterinary medicine degree. I've been with the Department of Health Services and the Division of Public Health for the past 8 years. And for the last 5 years, I have been leading food and waterborne disease outbreak investigations, either as an epidemiologist or now currently the leader of the Enteric and Waterborne Diseases Unit.
All right, wonderful. Thank you both so much. Let's jump into these questions. And the first one comes in from Froggy on Twitter, who asks, when new cases are discovered in Wisconsin, do you do some investigation to determine how the person may have contracted the virus? And that's really a little bit about the contact tracing we've been talking about.
Yeah, so that's a great question. And so let me sort of talk you through the process here. So when a case is identified, someone tests positive for COVID-19, the local health departments, and the local health departments are really the epicenter of where this work happens in Wisconsin. The local health department reaches out to that individual and does an interview with them. And the interview asks them about their symptom history, when they became ill. It asks them about places they might have been, so we can sort of ascertain what their different exposures might be. And then it asks them to identify people who they've been in contact with for the 2 days before they were ill and up until the last point where they were sort of out in the world where they might have had contacts. And we've been doing this all along. The local health departments have been doing this all along, really, since case number 1 in Wisconsin. And so what we do then is we take that information that has been gathered from the case and we use what they provided us on their contacts to follow up with contacts who then are identified, and the local health departments also are doing this. They make phone calls to those individuals and they let them know about their exposure. And they talk to them about what symptoms they might be monitoring for if they're currently feeling well. If they are experiencing symptoms, they talk to them about the need to follow up with their healthcare provider and have potentially a COVID-19 test. And then they also talk to them about the need for quarantine and what that looks like and where to limit their contact with others, some additional things beyond safer at home, and also trying to limit contact even with those in their household during that quarantine period if possible.
And we have a lot of the data on our pages about the cases and the tracing, and we've seen in the news nursing homes and manufacturing facilities, and we just launched that facility-wide investigations page. So how does an outbreak investigations work when you have a group of cases like that in one place?
Yeah, so first I want to start off by saying that outbreak investigations, even before the COVID-19 outbreak started, have been routinely conducted by epidemiologists or disease detectives here at the Department of Health Services. And one of the main goals of an outbreak investigation is to stop the spread of the illness. And depending on the type of illness and the agent that's causing the illness, we have different tools to stop the spread. And in foodborne outbreaks, we're trying to get the food pulled off the market, whereas in COVID-19 outbreaks, our tools are maybe a little different. We want to focus on things like Tracy mentioned, contact tracing, and implementing the proper infection control measures, including personal protective equipment use. And during any outbreak, one major tool we always use is our partnership with our local health departments. We work very closely with them during outbreaks to effectively and efficiently investigate the illness and stop the spread of the outbreak.
And you just talked about working with the local public health departments. And Tracy, you talked about this a little bit. Lisa just wrote in and said, is the Milwaukee Public Health Department tracing consistently? And that's really a question for all public health departments across the state, right?
Yeah, so our local public health departments work very hard to do case interviews and contact interviews with all cases of COVID-19 that are identified and then with the contacts that are identified. And I'll mention that this is not something that's new to the public health system. So contact tracing is something we do very routinely for other illnesses as well. So we do it for sexually transmitted infections, for things like tuberculosis, for measles. So contact tracing is something that public health has been using as a tool for decades. And so we're applying it to a new disease, but it's really a tool that public health is really comfortable using for these kinds of investigations. And so the local health departments are working to do contact tracing, and then we have, of course, some supplemental staff at the state level that are helping with that and helping local health departments where they are maybe exceeding their capacity locally, and we've been glad to be able to identify staff who can help to meet those needs.
And along with that staff, there's been a lot in the news about the 1,000 contact tracers we want. Melissa wants to ask us a little bit about Badger Bounce Back. It's one of the criteria. So how many contact tracers of the 1,000 have we brought on? And Christina wants to know how to apply for those jobs.
Sure. So thanks, Melissa and Christina, for those questions. So far, in terms of supplemental contact tracers at the state level, we have trained about 400 state employees. And these are people who are being reassigned from their normal work duties, Department of Health Services employees, but employees of other departments across the state government enterprise as well. And so there's 400 of them so far, and we're working on training another 50 or so this week. So we continue to build our resources that way. And then there's also the plan to hire additional people to fill some of these needs that would be outside of our current state employees. And so a plan is in the works, and that's those additional 1,000 people that you've been hearing about in the news. And so a plan is in the works for that, and we'll certainly be keeping the public informed of when those positions are available and what the requirements are and how you would apply.
And you talk about those requirements, and Zach wants to know if there's any kind of training for non-medically trained volunteers, and what kind of an education do you need to be a contact tracer?
Sure. So at the point where we would be posting those positions, certainly that's where we would provide some really specific information on what we're looking for individual qualifications. But I will say that not everyone has to be a medically trained person to do this necessarily. We do have people, who have different career paths within state government who are being trained to do this. It's certainly helpful to have some knowledge of some medical terminology, but there will be really specific requirements sort of as we roll this out, but not necessary to be a nurse or a doctor, as a minimum requirement.
And Shanti asks, don't you have to test in order to trace? People are still asking for tests that maybe have mild symptoms and they want to get those done, and what's the process there?
Sure. So, of course, the whole process of contact tracing does start with testing. It starts with finding people who have symptoms, getting those symptomatic people a test, and we really do recommend that people who are symptomatic would call their healthcare provider and see about testing. And providers, of course, are going to use their clinical judgment on who would ultimately get those tests, but we recommend if you're having symptoms that giving a call to your provider would be a good idea. So once we have someone who's tested positive, again, that's sort of the starting point of the whole investigation, and we identify their contacts and then do contact tracing out from there.
And if someone tests positive, will a contact tracer call them, and what questions will they ask?
Yep, so if someone tests positive, that's the case interview. So someone will call them, likely from a local health department, or maybe one of those staff from the state health department would be the person to call as well. And that's what I mentioned before. They'll ask information about symptoms, where you've been, what your exposures might be. Are you working? Maybe this person's an essential worker, and so we're going to want to know about their workplace and people who they might have been exposed to in their workplace. So those are the kind of questions that someone could be expected to have asked of them if they are a positive case who's getting a case interview.
So the difference between a case and then a contact is...
Sure, that's a really great point of clarification. So a case is someone who has tested positive for COVID-19. So they have a positive result, or they maybe were a close contact of a confirmed case, and so then we would call them a probable case, and they would also be getting an interview, a case interview. And those are people who are sick. So then the contact interviews is a little bit shorter interview, and we're also going to ask if you're having any symptoms, of course, when we call, because we want to identify anyone who might have developed symptoms. But contacts are people who are maybe symptomatic, maybe asymptomatic, but have an exposure to someone who is a case.
All right, and Abby wrote in and said, my grandma is in a nursing home. It sounds like there are a lot of outbreaks in nursing homes across the state. Will I get notified if there are cases at my grandma's nursing home?
Yeah, so CMS actually recently issued new updates that states that nursing homes should notify the residents and the residents' representatives when there are cases in the facility. So if you fall into that being the resident's representative, then yes, you should be notified.
And is that, who notifies you?
I believe it's the facility that's going to be notified.
Okay.
Yep.
All right, and when we talk about the facilities, we just launched that page that we talked about earlier. Why are you defining an outbreak the way you are? It sounds like you only need one case in some facilities, you need two in others. How is that actually an outbreak?
Right, and that's why, so right now on the page, it's investigations, not outbreaks, because we do have some of these types of facilities where it is only one case, and really those are the very vulnerable settings that we want to make sure that those mitigation strategies, like making sure the PPE is being used properly and other mitigation strategies are in place, because we want to protect that vulnerable population and want to, start that process as soon as possible.
And you say that the folks who are in the nursing homes or related to the people in the nursing homes will understand that. But we got a question on Facebook, if there's an outbreak at a nursing home in my region or somewhere else in my region, how do I find out if it's in my county or if it's in my town?
Right, so right now we on the page, we have it by public health region. And if there was, an outbreak that impacted you personally because you were a contact or, something along those lines, like Tracy said, the contact investigation people would be reaching out to you to conduct those interviews.
And we got a very similar question about jobs. If there's an outbreak at my job, will I be notified? And my work is essential, so if there's an outbreak there, will my workplace be closed?
Right, so the local health departments are working very closely with these facilities that have a COVID-19 outbreak, and they are also kind of along the same lines as the answer to my previous question. If somebody needs to be notified because they were a contact of a case or anything along those lines, they will notify those employees. And as far as if the facility will close, that's really on a case-by-case basis, and working with the local health departments, we help determine that if the facility needs to close.
All right, and we're watching these questions come in, and I want to remind our viewers that we have experts here talking about contact tracing and about outbreak investigations, and so they are prepared to answer those questions for us. And we got another one about this. What do you do when you find out about an outbreak? What should someone do, and how is that different from the contact tracing that would happen anyway?
Right, so I think outbreak investigations and contact tracing goes hand in hand. So the difference is the outbreak investigation, we have, we start with the cluster of illnesses in some sort of facility. So in addition to the contact tracing, there's other things that need to take place, other mitigation strategies within the facility that can be put into place to help slow the spread. But contact tracing is definitely a part of an outbreak investigation.
And we just got a question also. It would be helpful to understand whether the people have been staying home, healthcare workers, plant workers who are involved in these outbreaks. Can we find this out? How would someone find that out?
Right, so I know on our site, we also do have, some of this information for just the general cases as far as healthcare workers and that sort of thing. And I think really this goes back to the point that if you are a contact of a case through this contact investigation, you will be notified. So those people at risk are being notified through the contact tracing.
And I think, Jordan, what I would add to that is that local health departments work very closely in any of these outbreak situations to identify those people who are cases. And like any other cases associated with an outbreak are put in isolation. And so there are specific rules public health is using to determine how long someone needs to be in isolation. And so the public health departments at the local level are really engaged with these outbreaks and making sure that people know what their isolation period is.
And Tracy, you talked about the isolation period, so can we, I know we've talked about this before and it diverges from the topic a little bit, but can we talk about quarantine and isolation and what folks want to do in some of these situations?
Sure. So quarantine is what we generally would use for someone who is well. And a quarantine would happen for someone who has a known exposure, so they're a contact in some way to a confirmed case of COVID-19, or maybe they, in the past, one of the things we looked at especially is travel to an area where there's widespread community spread. So those individuals are asked to be in quarantine for 14 days, and there are maybe some differences to that depending on them being a critical healthcare worker, but the general rule is a 14-day quarantine because that's how long the incubation period we think would be for COVID-19. So we ask those individuals to do that. And then isolation is different. So isolation, I always like to say I and I. Isolation is for ill people. So that's sort of the easy way to remember it from quarantine. And isolation starts when we start counting when you would end someone's isolation by looking at what their onset date is. And so at this point, our recommendation is to say we would want someone to be at least 7 days since the onset of their symptoms, and then they are well, or their symptoms are improving for at least 3 days, and that would be absence of a fever and severe respiratory symptoms, and just generally feeling well for 3 days. So we call it the 7 and 3 rule. So symptomatic for at least 7 days, and then getting better for at least 3.
All right, and I'm gonna take you away from our topic one more time because we are getting questions again about Badger bounce back and the 14-day, the criteria on that. So can you just talk a little bit about what the 14-day decrease in testing means?
Sure. So the 14-day decrease in testing piece. So what we want to see is a downward trend in the percentage of cases that are positive over a 14-day period. And so there are some nice metrics on the DHS website, some nice charts that are helping to start to get a look at this and to see and to sort of show where we're at. There's a really nice dashboard if you go to our DHS webpage. And there are actually several metrics, and you can see on the dashboard sort of the red, yellow, green to see where we're at in terms of those metrics. But what we really are looking to see is a change in the percent of cases that are testing positive on a given day, and we really want to see that going down.
And Andrea wrote in on Facebook and said, it seems like the criteria is impossible to meet because the more people we test, then the higher the case counts. And I know you've talked a little bit about percentages versus numbers before, so I'm going to ask you to do that again, please.
Yeah, that's great. Thanks very much, Andrea. And I think the easiest way to explain this is if you think about testing 1,000 people, and if you have 10% of them who are positive, you'd have 100 cases. And then if you tested 2,000 people and you also had 10% of them who were positive, you would have 200 cases. So your case numbers there are very different. You have 100 cases versus 200 cases, but we still only have 10% of people who are testing positive. And so that's really the reason you want to look at that percent positive rather than just individual case numbers to sort of see what the trend is. And we also are looking at that, especially now as we're seeing an increase in the number of tests that are happening on a daily basis, and hope to continue to see that number of tests that are being done on a daily basis go up. It allows us to compare numbers over time more easily.
All right, and when we get back to contact tracing, we have a question about what has the state been able to learn through contact tracing and through outbreak investigations? Can you actually find patient zero?
Oh, that's a good question. So in terms of finding patient zero, I think that's not something that we're really attempting to do with these tools, right? What we're really attempting to do with contact tracing is to say we have a case, and what we want to do is identify people who were then exposed to them who might become future cases and reduce any exposure they might have to other people. So the goal of contact tracing is not to go back and pinpoint person zero. It's really to identify people who have potentially been exposed and reduce their exposure to others going forward so we can stop the spread of the illness.
And when it comes to contact tracing, we're getting a question about whether or not you are sure you can guarantee that people are being truthful when they answer these questions.
Mm-hmm. So what we're finding when we talk to people, and local health departments are doing a lot of this, and our, of course, our state contact tracing team is helping to supplement that. But what we find is that Wisconsinites are great, and they really want to help protect their communities, their friends, their family, their neighbors. And so people in general have been really willing to comply with the quarantine and isolation. And so, you know, we feel like people really are being truthful, and they're really motivated by protecting their family and their friends and their neighbors.
All right, wonderful. And then we have a question about how contact tracing helps with the outbreak investigation. So how are those two kind of tied together?
Right, so during an outbreak investigation, we identify that initial cluster of illnesses linked to, you know, some facility. And then it's that contact tracing that really helps us identify, you know, how far has the spread in the facility, what other community contacts may be linked to this outbreak. So it definitely is a major part of outbreak investigations.
And can you just, someone is asking if you can just kind of talk us a little bit through, you talked about it a little bit earlier, but the steps
Right.
of what you do when in an investigation.
Right, so, and like I said, this is a lot of this work is done by the local health department, and we, you know, help them through this process. But so a cluster of illnesses linked to a facility or in the same facility is identified. And then we start working with the local health departments and working with that facility to identify what mitigation steps can be put into place. So, you know, if it's in a nursing home or other long-term care facility, it's going over, making sure there's the proper PPE, that they have to keep everybody safe, making sure that they're screening employees and that sort of thing, and keeping out ill employees. And if it's in a, you know, some sort of manufacturing, are there ways we can implement social distancing? Are they doing that already? And that sort of thing. So it's working with the facility to get those mitigation steps in place. And then also, as the outbreak progresses, it's doing the contact tracing along the way to make sure, you know, we identify any work contacts or any community contacts, and we can quarantine them. And then, you know, it's just monitoring the situation and making sure those mitigation steps are helping, you know, slow the spread of illness.
All right. Wonderful, thank you. And we don't have a lot of time today because Facebook has put a limit on us. So before we go, do you have any kind of closing remarks? Is there anything that you would like to get out to our viewers right now?
I want to say to everyone who's watching, thanks for giving us the opportunity today to talk to you about contact tracing and outbreak investigation. These are really valuable public health tools that we use in a variety of settings and for a lot of diseases, and we have a great team of experienced epidemiologists and public health nurses, both at the state and local levels in Wisconsin, who've been doing this for a long time, and we're really happy to have the opportunity just to tell you a little bit more about what we do and to answer your questions.
All right, wonderful. Thank you. Thanks to Tracy and to Jordan, and thanks to everyone who has sent in questions about contact tracing and about outbreaks investigations. We appreciate that. And you can always get the latest information on our DHS website. We have several pages devoted to COVID-19. Just log on to dhs.wisconsin.gov, and we'll see you next time.